Well, we have Ms. Dawson here today. Hi, Ms. Dawson.
Hi, how are you?
Good, and you're here for a follow-up, correct?
I am.
Okay, tell me what were you following up from? Why are you coming back here today?
I had severe dry eyes, a case of severe dry eyes, Sjogren's, where I was having to use anywhere from 13 to 20 drops a day.
13 to 20 per day.
Right.
And we were just saying, how can you even live your life if you're having to put drops in that often?
Right. It was hard. I was struggling with it. And sleeping was unbelievable. I would wake up and my eyelids would be stuck to my eyes. I could hardly get my eyelid open. So I came to you to help.
And then I suggested you start these Platelet Rich Plasma drops, right?
Right.
Okay,
Right.
and tell me about your experience with that. So you started using that, and then what was your first feelings about it when you were using it?
Within the first 2 days, actually, I could tell a difference. And not only did it soothe my eyes as the drops went in, but I was so, I couldn't even go out in the sunlight. The sunlight bothered me terribly. And the second day that I put the drops in, I was able to go out in the sunlight. I mean, not to look in the sun, but just to go out in the sunlight.
Right.
And nothing, the next morning when I tried to open my eyes were fine.
Wonderful. And how many weeks have you been on the drops now?
I've been on about a month.
Okay, wonderful.
Mm-hmm.
And then now you find you're not having to use drops.
I don't use drops at all except the Muro that you had told
At
me.
nighttime, yeah, I
At
talked about
nighttime, the
Correct.
salve to
Yeah.
put in my eyes.
So that plus the PRP, and you're not having to use it 19 times a day now. You're just use like 2 or 3 times a day now,
Right.
The PRP
Drop
drops.
3 times a day and
And what's the amazing thing about these drops is they actually help. They put a cell on the surface of the eye that tells your body to bring stem cells to that area to heal the area. Because when I looked at you today, the amazing thing is I don't see any irritation on the surface of the cornea where you had some irritation there and cells that were missing, they're all back. And even the inherited condition looks better. So
it's wonderful.
thank you for sharing this story with us. So you're finding this has been pretty dramatic for you.
Most definitely.
Wonderful.
Most
And you would
definitely.
recommend this to other
I
people?
most definitely would. It's life-changing, actually, to have it and then to get this far with it. It is, most definitely.
Well, thank you for sharing your story.
Thank you.
Okay.
Thank you for helping me.
My pleasure.